we visit doctor, he examines us physically. Oftentimes we wonder what's he looking for. Such a weird feeling, right? So this video helps you to know what doctor observes when he looks into our eyes, ears or face. Basically this is called physical examination. So let's don't delay and get into the concept. The physical examination is typically the first diagnostic measure performed after taking patient's history. Ideally, a complete physical examination should be performed for every patient. The main objective of physical examination is to determine a working diagnosis or differential diagnosis. Secondly, to adjust approach from full to focused physical examination as needed based on medical history, patient condition, and findings. Tools for physical examination are pens, stethoscope, pen light, tongue depressor, reflex hammer. If necessary, otoscope and ophthalmoscope are also used. Techniques involved in physical examination are inspection, palpation, percussion, and occultation. Inspection is done to specific areas of the body to observe normal color, shape, and consistency. This is done for skin, face, eyes, neck veins, abdomen, leg joints, etc. Palpation. Examiner uses hands to feel for abnormalities. This includes lymph nodes, chest wall, abdomen to check for any masses or lumps. Percussion taps the area of the body. This tapping produces different sounds. Depending upon the sounds produced over abdomen, back, or chest wall, he or she may get clues for diagnosis. And finally, occultation. Here, physician listens to the heart, lungs, neck, abdomen to identify problem. This is generally done using stethoscope. This amplifies sounds heard in the area that is being listened. General appearance, posture and movement, grooming, color, rosy, pale, flushed, or jaundice. Behavior, alert, calm, active, compliant, agitated, etc. Vital signs such as temperature, heart rate, respiratory rate, blood pressure, oxygen saturation are observed. Uh, Weight and height are also taken. With this, we can calculate BMI. In children, head circumference is also taken into consideration. Physical examination of the skin. Skin examination to the patient is done in good lighting. Inspection and palpation of the skin is as follows. Color, texture is observed. Turgor. Take a fold of skin and note the ease with which it moves and the speed with which it returns to the normal position. And secondly, moisture, pigmentation, lesions, hair distribution are also considered. Warmth. We can feel this with the back of our hands. Normally, skin color varies based on race and environmental effects. Few moles and areas of depigmentation can also be encountered. Fine hair is seen over most of the skin. Hair distribution varies based on sex. With aging, texture and turgor of the skin changes, loss of stretches. Skin tend to be dry. Aging spots are also seen which are irregular and pigmented. Hair and scalp. Color and condition is naturally pale black to black with smooth and firm texture. The length may be short, long, or medium. Amount and distribution is like fine hair covers overall body except soles, palms, lips. Abnormality is excessive generalized hair loss or patchy hair loss. Scalp is generally hard and smooth without lesions. Sometimes lesions or lumps are noted, which is an abnormality. Nails. Nail tone is pink and with of no markings. On the other side, pale cyanosis nails and yellow discoloration is an abnormality. Normally, nails are convex in shape with 160 degrees angles between nail base and skin. Abnormality is early clubbing, late clubbing, and spoon nails are also observed. Physical examination of the eye. One of the best ways to tell that a patient is anemic is by looking at his mucous membrane of the eyes, also commonly referred to as the waterline above the lower lashes. If this vascular area is pale, it is a sign that he is not getting enough RBC to other areas of the body either. Commonly, other conditions such as diabetes, hypertension, atrial plague, multiple sclerosis, stroke, leukemia are also known by physical examination of the eye. In diabetes, the eye is dilated. This is the only best way to diagnose retinopathy in diabetic patients. Besides diabetes, hypertension is also known by keen observation of the eye. For early signs of high hypertension, the doctor observes for retinal vascular damage by fundoscopic examination. Hypertensive retinopathy also causes cotton wool spots, yellow hard exudates, and optical disc edema. And next, nose. Nose can be inspected from the front. To examine the anterior nares by lifting the tip of the nose and looking inside without a speculum. Inspection is done using otoscope. This allows examination of the vestibule, anterior portion of septum and inferior, and also middle turbinates. Next is ear. Earaches, ear infections, ringing in ears are common complaints. Physical examination is done to diagnose. Doctor dims the light in the room to use otoscope. An otoscope is a handheld light with a removable plastic tip shaped like a cone that allows the doctor to look inside the ear. He may gently pull the ear in up, down, forward or backward directions. Next, mouth. Mouth is the beginning of digestive system and substantial part of respiratory tract. Firstly, we'll talk about lips. These are normally pink, moist, smooth and symmetrical in shape. Abnormality leads to growths, lumps or discoloration of tissues, cyanosis and dryness. Next, teeth. They should be clean with no decay, white shiny enamel and smooth surfaces and edges. Abnormality findings are missing, loose, broken and misalignment teeth. Gums. They should appear symmetrical, moist and pinkish in color with well defined margins. Dark skinned may have a melanonic line along the gum margin. Abnormality findings include swelling, cyanosis, paleness, bleeding, discoloration, and sponginess. Coming to tongue. Tongue is inspected from all sides. Top side of the tongue is symmetrical, pink, moist, slightly rough from the papillae, possibly with a thin whitish coating. Sides of the tongue are inspected with gloved hands holding a piece of gauze. Inspection from the bottom side of the tongue is done by asking the patient to touch the tip of the tongue to the roof of the mouth. This appears smooth, moist, and free of lesions. Marked redness, cyanosis, and extreme pallor are the abnormality findings. Tonsils. Patient is asked to open their mouth and a tongue blade is used to depress the tongue. Tonsil side is graded as visible halfway between the tonsillar pillars and ulva. This is 2. And the third grade is touching ulva. For the fourth grade, they should be like touching each other. So, with this, we completed part 1. We'll have part 2 and part 3 also. Most probably, we'll conclude this video with part 2. Thanks for clicking and sharing your valuable time. Please like, share, and comment. And also don't forget to subscribe to my channel. Okay, see you all next week. Bye.